Corey McFadden hanging out with me while Jean is off on vacation this week. And all this week we've been looking at ways to help and perhaps delay the skin aging process. Now we've hydrated in the 30s. You missed that. So you're supposed to hydrate.
No, I've been hydrating.
Oh, okay, good. Okay, you got to do that. In and out, you got to do that. Now, in the 40s, we started Botoxing, but now we're moving into the 50s and beyond. So, with more ideas for another skin spring time spruce up is distinguished dermatologist Dr. Amy Brodsky from Chicago's northern suburbs. So nice to see you, Dr. Brodsky.
To see you.
So we're not going to be depressed by this, are we?
No, not at all. We're going to be excited about it.
Okay, all right. Let's first talk about what happens to skin as you move into your 50s. Like, what's the process? I think we have a little graphic here so you can kind of go through some things that we can expect.
So there's extrinsic things that we cannot necessarily control, like smoking. Well, you control that. Sun, it's really important. Most important is to start sun protection as a child, as you get older. And then also, hormones and things like that. But as we get older, things happen to your bones. You can see here that the bone shifts. You lose a little bit in your temporal area. You lose a little fat there. And your cheek bone and the fat drops. And most importantly, your jaw shifts backwards, especially if you it's called bruxing. If you grind your teeth at night, your jaw will shift backwards. You'll start getting the nasolabial folds here, some wrinkles around your mouth. And so all of that can lead to aging. And so there's a lot of things that we can do now to help with that.
Right. See, I think that's interesting because I think a lot of women, don't you think, like, I just think it was the skin on top. And I'm like, oh, it's just sagging, and if I pull it back, I didn't realize, like,
I thought it was the skin, too. I had no idea your bones actually...
That everything is moving.
It's your skin, it's your muscle, it's your fat, it's your bones, it's everything. It's important to keep care of your skin. And with our model today, we can tell you what she started doing and what we did
to kind of remedy it. Okay, so we have our model Karen, who's into her 50s, and so what are some of the things that we could start doing that would really help?
Okay, so with Karen, you can see here that her eyebrows have sort of lifted to help open her eyes and to help her see a little bit better. And you can see that her temples have sort of been concave. And she frowns a lot. She's a little stressed. So here we did some...
we know Karen, so that made me laugh.
A little stressed. And, and then her little bit of crow's feet. So we did a neuromodulator. And then you can also see that her cheek pad has fallen and the apex of her cheek has fallen. And then you can also see she carries her stress in her mandible as well as in her chin. She's got a little bit of...
What do you mean, like
in her jaw? So she probably grinds her teeth at night. And she may have been a bit of a smoker in the past, so you can see some lines around her mouth.
Okay.
And so all of that sort of starts to get static as we get older.
So in the past, we talked about this yesterday, so our parents and grandparents or whatever would have done surgery to kind of move everything. But now there's stuff that you did in the office.
Awesome
and
stuff.
What, like fillers? Like what kind of things did you do to Karen, and we're going to see it before and after?
So I did sort of an art of the aging face. I used multiple modalities. I used neurotoxins, which include
oh my gosh.
Wow. Wait, okay, go ahead. Botox, what else?
So neurotoxins are Botox, Dysport, Xeomin. I used a collagen stimulator called Sculptra, which sort of lifts her face and kind of gives her that lifted appearance. I gave her some temples back. And then I used some Voluma in her cheeks, which is a hyaluronic acid that's really kind of a robust filler. What I did, which I thought was really interesting around her mouth, is we did some neuromodulator around her mouth, and I injected her masseter muscle so she stopped grinding. I injected her chin so she stopped dimpling. And then around her mouth, I used Restylane Silk, which is a new product that actually I treated above her lip, not necessarily in her lip. And then also we used a little bit of Juvederm or Restylane, a tiny bit. You know, I don't really go much for the nasolabial folds anymore right here.
Yeah, because that's something that's telltale when you're
like... Right, you don't want to look like, God rest her soul, Joan Rivers. You don't want to look face forward. So really, the art of the injection is back here and up here to sort of lift you. And the key is to look better but not different.
That's so funny because Karen got that done and she did look really refreshed, and I never would have said like, oh, Karen, you had a lot of work done over the weekend or something like that. So really you have to make sure that you find somebody that's very skilled, because you're talking, it's like a painting, what you're talking about.
Well, I'm actually an oil painter, so for me, it
artist hands,
it's
literally.
an art. I mean, I think that obviously I need to know every muscle, bone, nerve, vein so that I don't bruise a patient and that I don't necessarily inject them in the wrong place. And in addition to that, there is an art. You need to know the right angles of the face. You need to know where it should look normal. And you want to make sure you see the symmetry in the eyebrows. Your lips should be twins and your face should be siblings. So
Okay,
half
right.
of your face should look like the other half, but not exactly.
Right.
And then your lips should look exactly alike. And there's a lot of proportion and ratios
Okay.
that go into it.
At what age should we start? So like, you know, Corey's, in
Yeah.
her, you know, she's starting, what are you, 33?
I'm 33.
33, like at what point, so that you don't ever need surgery kind of thing? Like what time, or is it just everybody's
I'm
face?
starting my children with sun protection. And
Sun-
that's
oh, I was like, what?
Fillers?
No.
Wait, Zelda needs Restylane Silk
No,
already?
I do not,
Stat.
do not put Botox in your
Okay.
10-year-old.
Yeah.
Right.
But the most important take-home point is start young, prevent them from getting sun damage.
Yeah,
Sun
okay.
protection.
Best
That's,
thing.
as your physician, I'm telling you that. And then start with retinoids at night and antioxidants as well. And then kind of transition. You can do some laser. I also did a little laser resurfacing on Karen
I've done
under
that.
the eyes.
Oh, have you?
And so you can start with sort of the non-aggressive things, which are creams and peels and laser resurfacing, and then you can sort of transition into injectables.
Right. Okay, Dr. Amy Brodsky,
Yeah.
thank you so
Amazing.
very
Thank
much
you.
for this spruce up. Now this explains why Karen had such a little bounce in her step.
Yeah.
I'm serious, I didn't know. So
That's like a true spring spruce up.
Right,
I'm
right.
like, it's amazing.
If you need more information on Dr. Brodsky, her dermatology practice, and her skincare clinic, all you need to do is head to thederm.com.